Hello, myself Dr. Sudeshna Mukherjee, consultant psychiatrist practicing in Siliguri. Today we'll be talking about ADHD in adults. So ADHD means Attention Deficit Hyperactivity Disorder, and mostly we have heard about ADHD in children. But adults can also have ADHD, and it is a very kind of a confusing symptom because ADHD has a lot of overlapping symptoms with common mental health disorders like anxiety, depression, or any kind of restlessness behavior. Some of these symptoms might match with ADHD. That is why many a times people having these disorders often confuse that they have ADHD. So we should know briefly what does ADHD in adults actually look like. So ADHD, we should understand that it basically has a few components, right? Hyperactivity, inattention, and impulsivity. So whenever we are talking about ADHD in adults, so it could be that the symptoms of hyperactivity, inattentiveness, and impulsivity should start before the age of 12 years, and more than 5 symptoms, as in the diagnostic criteria of ADHD, should be present which are persisting for more than 6 months. And all the ADHD symptoms, it should be affecting more than 2 settings, like settings in as in home or work. Those symptoms should be seen in all kind of settings, in the home also, in the workplace also, and it should be causing significant occupational, social, and personal functioning impairment. So what could the symptoms be? It could be like fidgetiness, unable to wait for your turn, blurting out answers, misplacing things, forgetfulness, always being unable to sit and concentrate for some time, difficulty focusing, unable to understand that you have to stand in a queue, you're always on the run, you're unable to understand that you have to go in a stepwise manner. So all these kind of fidgetiness or forgetfulness, in a way, when you misplace things, when you forget things, when you cannot focus, all these could be subtle signs of ADHD. But as I already said, that these are overlapping symptoms. So the similar symptoms might be present if you are anxious, if you are depressed, or if you are in some kind of stress. So if you need to differentiate between them, if you need to understand that if you have ADHD, you need to talk to your therapist, you need to talk to a psychiatrist, because they have scales for ADHD measurement, they have a clinical assessment, and they can tell you if you have ADHD. So do keep a check. Thank you.